Morning. Europe also doing well. Of course, healthcare has been the leading sector for merger activity so far this year. We're seeing a record number of deals within the space. Biotech stocks also among the hottest in the market right now. I want to talk more about that right now with Mark Perrin. He is chairman and CEO of InVivo Therapeutics, a biotech company focusing on spinal cord injuries. Good to see you, sir. Thanks so much for joining us.
Pleasure to be here.
Where are you in terms of the progress of these spinal cord injuries? Tell us about some of the cures and recoveries that you're coming up with.
Right. So one thing that's tragic about this space is there really has been nothing done for these patients. When you are injured and you're completely or partially paralyzed, you're basically giving a lifelong sentence saying, you're never going to recover. So what's so exciting about InVivo is we're developing what's called a scaffold. So upon injury, the patient has a novel surgical procedure done. The scaffold is inserted to bring back either functional recovery, sense recovery, bowel and bladder control, all the things that are lost on a complete paralyzed patient.
So the stocks had a big run here, yes, like a lot of biotechs have. Congratulations on that. But yeah, is there any way or anything you're doing that can actually cure paralysis? I mean, when somebody's, their spinal cord is crushed in a severe accident, is there any way to reverse that?
Well, our patients, we have 3 patients enrolled so far in our trial who are completely paralyzed, nothing below the site of injury. And 2 of our 3 patients have regained either motor recovery, sense recovery, or bowel bladder control. That happens in less than 5% of patients when we look at historical data. To have it happen in 2 out of 3 patients, probability of that is less than 1%. So we believe we're on track to find something to really improve the lives of these patients.
What about expanding the trial and the length of the trial? Like, what is the outlook?
So we have a pilot trial now for 5 patients. Mm-hmm. We'll be talking to the FDA and rolling it into a probable benefit trial, a small trial with probably historical controls, and hope to get on the market in just a few years.
So in terms of from investors' standpoint, Mike makes the point that the stock has run up. When are you expecting to see real revenue and profitability? What's your timeline?
Yeah, well, it obviously depends on, we're working with the agency on how fast we can get this through the regulatory pathway. We are designated as a humanitarian device exemption. That means we can get through the process in a more simple and faster way. But it will really depend on how fast we enroll these patients to continue to demonstrate the tremendous results we've seen so far.
Are you going to have to do a deal? Do you need scale?
I don't think so. I think because these patients are treated in less than 200 Trauma 1 centers in the United States, that would be easy to cover from a commercial point of view, so we could vertically integrate this company and commercialize it.
And so once you get green-lighted, there's been so much M&A activity in the space. I would think one of the big guys would definitely be circling around. Or is it something you want to go alone, or is it something you need more backing to really get this product out?
I think that's always possible. I think that what our sole focus has to be is on the patient. I've always felt this way. When you take care of the patients, the valuation follows, and whether that's valuation as a vertically integrated company or you're part of an acquisition or an M&A activity. But you got to deliver the proposition.
What's the potential cost of treatment?
Well, that's an interesting point, because to treat these patients, the healthcare system spends well over $1 million just in the first year to take care of these patients, and the costs ongoing are significant. And so if we can just change just incrementally or even dramatically their functional ability, their sensory ability, bowel bladder control, all those things are going to take major dollars out of the healthcare costs.
So cost is really the major barrier to market entry now?
No, there's just been no innovation. It's not a cost issue.
In your specific space, there's certainly aside from InVivo. Good to have you on the show today, Mark.
Thanks so much,
Thank
Maria.
you so much. We'll be watching the developments, and I know a lot of patients out there are as well. We will be watching InVivo Therapeutics. Happy to have Jill